Good afternoon, ladies and gentlemen. We're going to begin our webinar. We want to thank you so much for being with us today. I'm Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council, and we appreciate you being here for this educational webinar, which is done in conjunction with hospital pricing specialist, an associate member of the council. Today's topic deals with the 2024 CMS pricing transparency rules. This is a very timely topic as price transparency mandates continue to be even more stringent this year. Medicare's 2024 final rule for hospital outpatient payments includes updates to the transparency rules. When will hospitals need what will hospitals need to do and how you can avoid citations? We will learn the answers to many of these questions during the discussion. Even this morning, I was reading an article in Modern Healthcare, and that article dealt with some of the hospitals, some of the pricing changes. So this is an extremely timely webinar. We're delighted we've got Rick Louie with us today, the Managing Director of Hospital Pricing Specialists. We've got Etosha McGee, Vice President, Consulting Services, also with Hospital Pricing Specialist, and Faye Openshaw, who's the Vice President of Business Sales with Hospital Pricing Specialists. We have a great turnout today, and we've been looking forward to this presentation. But before we begin, if you have any questions, feel free to type them in the question box or even the chat box, and we'll be able to work at answering them at the end of the webinar. And so it's now my pleasure to turn this over to Etosha McGee. Etosha?
Thank you. We are delighted to join you all this afternoon, and so thankful for the opportunity to talk through some of those changes to the price transparency rules. I'll tell you a little bit about our team at HPS. We'll go over the new price transparency requirements that are coming into play for 2024. We'll talk about some key compliance dates, and then some opportunities to essentially turn lemons into lemonades with looking at how you can utilize price transparency for some opportunities to review the pricing at your facility. And finally, we do have an offering for those in attendance this afternoon. Hospital Pricing Specialist was founded in 2011. We are based out of Silicon Valley, and we focus solely on hospital pricing analytics. We also have a national database of hospital claims, hospital machine readable files, as well as the payer machine readable files, which some of you may be familiar with as the transparency and coverage files. We have 100% transparency compliance score with CMS, and we're very proud of the work that we've been able to do with our provider clients. As mentioned, our Managing Director, Rick Louie, is joining us today on the call, as well as Faye Openshaw, VP of Sales, myself, Etosha McGee, and also not with us this afternoon, but a key member of our team is Randy Brantner, our Vice President of Operations. So very quickly, taking us through that timeline of price transparency. So back in 2015 is when we get the Affordable Care Act and sort of those first rumblings regarding price transparency and changes to how hospitals would need to display pricing information. In 2019 is when we really get the first requirement. So prior to that, there was, opportunities to voluntarily post your charge master and recommendations around voluntarily posting your charge master. But it isn't until 2019 that we get those first requirements, which was posting a CDM and then posting an inpatient file that was a list of charges by DRGs. It's then in 2021 that we get kind of what we know of as price transparency today for hospitals, which is the machine readable file that includes the 5 standard charges that's defined by CMS. So that's gross charge, payer negotiated rate, the de-identified min and max rates for all items and services in your facility. You also need to provide a consumer-friendly display of 300 shoppable services, or in lieu of that, a price estimator. So that's what's been in play for about 3 years for us, but now we're seeing a really big overhaul for 2024 with regards to the machine readable file component of price transparency. We're seeing a standardized schema come out, and we know that there's going to be increased enforcement around price transparency. So what is the purpose of the machine readable file? I think each time we talk about price transparency, it's really important to zero in on the exact purpose of the machine readable file. Because there are those two components, both the machine readable file as well as the shoppable component, because both need to be publicly available, I think sometimes there's some confusion about what the real purpose and intent of the machine readable file is. So we want to remember that CMS's goal, which is specifically stated in the final rule for the machine readable file, is that it's meant for innovation to increase price competition, that they foresee this data being used by third parties for app development, price comparison tools, searchable databases. So one of the things that can often come up with regards to the machine readable file is, well, that .json format or the structure of this or the size of this is overwhelming for my patient population. And I don't think that, my grandmother or my uncle can just go on a website and download this file and use it. And that's really not the purpose of the machine readable file. And we're seeing with this new standard schema that CMS is releasing, that continued emphasis on this file really being something that's meant for app developers and those who are accustomed to processing large amounts of data to be able to utilize this tool to then create those downstream tools that are patient friendly and can be used by the everyday person. So we're also seeing really increased enforcement, this ramp up in corrective action plans, letters going out, as well as the civil monetary penalties that are being released. The standard format that has been released and is going to be required starting July 1st, as well as the use of the CMS-hpt.txt file that is a January 1st of 2024 requirement. All of those things support additional automation around enforcement. This allows CMS or their designated enforcement vendor to write scripts and be able to automate how they are locating and ensuring that hospitals are posting their machine readable files as well as posting them in the appropriate format. There's been over $4.7 million in civil monetary penalties issued. The average penalty is roughly $313,000. And now all hospitals with a deficiency will be published on the CMS hospital price transparency website. So presently, what you would see is a hospital wouldn't be posted there until they actually received a CMP. But now going forward, anyone that's been identified as being deficient will now be publicly posted. So again, this emphasis on enforcement and really pushing providers to be in line with all of the requirements as it relates to price transparency. Additionally, we're also seeing that window of time to correct deficiencies significantly reduced. Prior to this, it took about 299 days from the initial letter that CMS sent out to an actual notice of ACMP. And now that's going to shrink down to just 90 days. So we are, again, really seeing that ramp up with regards to not just review of sites and ensuring that that information is out there, but also issuing those penalties to those facilities that are not abiding by the rules. So what are these new requirements and what are some of those key dates around those new requirements? So July 1st really is the big day with regards to the change to the format of the file. So July 1st of 2024, the standard schema that's now required by CMS is going to go into effect. In addition to that, there are a couple items within that standard schema that actually aren't required until January 1st of 2025. Those are related to drugs, and then also some calculations around estimated allowed amount, and then the modifier component of the schema. There were a few changes, though, that did go into effect January 1st of this year. So already, what's very important is that a text file that is stored in the root folder that's in the same location where your machine readable file is located should be live and hosted presently. That was effective as of January 1st. The content of that text file is explicitly required by CMS. It needs to contain the location of your machine readable file. It also needs to contain a point of contact for price transparency at your facility. And again, the really important component is that this file needs to be stored in the same location as your machine readable file. So here on the slide, I do have an example. This machinereadablefiles.com is the location where, for our clients, we host their machine readable files. We also now host that required text file for them as well. And so what you'll want to be sure of is that when you look at the location of your machine readable file and the location of that text file that's associated with your facility, that you're seeing that these documents are in the same location. If they are not, that is a current deficiency, as this was a requirement that became effective on January 1st. And the way to rectify that would be either moving that text file to the root folder of the location of your machine readable file, or conversely moving your machine readable file to the place where you're storing the text file. But those two things need to be in alignment. Another requirement that is in effect starting January 1st of this year is a footer link. So now every hospital should have in the footer of their facility's homepage a link to their price transparency resources page, and it needs to be labeled as price transparency. So prior to this, when you would go to hospital websites, you might navigate under a patient and visitors menu or a billing menu. Some hospitals had in their header of their main page a price transparency option, but now there is the standardized requirement. Every hospital, in addition to those other locations that they might still have price transparency linked out on their page, must now have a footer link at the bottom of their page that navigates to their price transparency page. Lastly, the good faith effort. Every hospital is being expected to make a good faith effort to ensure that the data in their machine readable file is true, accurate, and complete, and that they actually have it posted on their website. So what is really important for July 1st of 2024? I would say the number one thing is the data schema. Prior to this, as long as you had a machine readable file that had those 5 standard charges, included the billing codes of CPT or HCPCS or DRG or APDRGs, et cetera, format really didn't matter. What mattered most is that you had the applicable content and it was out there publicly available on your website. Starting July 1st, it's going to be really critical that that data isn't just out there and available, but that it is in one of the 3 approved templates that CMS has released. So there are now only 2 file formats available. Previously, as long as it was a machine readable format, it was fine. So that meant a text file, an XLS file, JSON, CSV, etc. Now we're limited to just a .json or a .csv file. And those templates are either the JSON, the CSV WUD, or the CSV tall. Any file formats outside of those 3 would not be compliant. And so it's very important, if you're not having those conversations yet with either your internal team who handles your price transparency or your external vendor, that you're making sure they're prepared and ready to convert whatever you have presently into one of these required templates. Some other changes are content. So again, As long as you sort of had those 5 standard charges and they were in the file and publicly available, you were covered. Now, it's really important to have all of these different components that are spelled out in the schema present in your file. One of the biggest changes includes charge methodology. So noting not just what your negotiated rate is, but what kind of negotiated rate that it is. Is it case rate, per diem, percent of charge, etc. Including pricing algorithms when a payer rate is not listed as a dollar amount. So in this case, having not just 70%, but that it is 70% and it is a percent of charge. So much more detail, much more granular components to this new data schema. Including the billing and accounting code and code type. So prior to this, you could list your CPT codes, HCPCS codes, even your charge codes in your machine readable file. They didn't necessarily have to be called out as what type of code it is. Now that's going to be critically important that you're noting that a CPT code is a CPT code, that if you are including your charge code from your charge master in your file, that you're indicating that this is a charge code. And lastly is the machine readable file attestation. So now for every machine readable file, it's going to be critical that, again, this explicit verbiage from CMS is also included in the file and that you're indicating it alongside the data components and in the appropriate location. So what's coming for January 1st of 2025? Estimated allowed amount. So in cases where for whatever reason, hospitals are not actually able to provide a dollar amount for their negotiated rate, there will be the ability to include a calculated estimated allowed amount. So going forward, if there's some sort of algorithm or, it's percent of charge base, but you don't have a hard and fast charge for this particular item, utilizing 835 remits to calculate a historical allowed amount is actually going to be required. So getting further and further away from just providing percentages and closer to being able to provide hard and fast dollar amounts for those things where, again, a hard and fast dollar amount doesn't necessarily always exist. That will now be required starting January 1st of 2025. Detailed drug information as well. So what are the drug units and what is the measurement? So is it milliliters, grams, etc. So very similar to those components that you see within the NDCs, that will now be required to be a part of the machine readable file. And then also modifiers, particularly those that are impacting reimbursement, will now also be required to be within the machine readable file. And that's all beginning on January 1st of 2025. CMS does provide a plethora of resources around hospital price transparency. So this link here, just under the title, cms.gov, priorities, key initiatives, hospital price transparency resources, is the page where all of the resources related to hospital price transparency are stored, from the most recent webinars going all the way back to some of the earlier webinars done around price transparency. So you can go there and be able to pull this information, see fact sheets, again, watch previous CMS webinars, as well as get their slides and notes as it relates to price transparency. There's also the GitHub. This is really going to be the primary source for those technical resources that you are working with to make sure that your machine readable file is in the appropriate format. This is the location where all the detail around the schemas and their corresponding templates is stored. So again, if you have an internal team that works on this for you, this is definitely a website that you're going to want to make sure they have at the ready and are very familiar with, because this is what they're going to use to help move your file into that correct format. There's also the GitHub page that includes a text file generator. So again, that text file is a January 1st requirement. You can go to this page and plug in the appropriate information, your hospital name, the URL for your source page for your machine readable file and for the text file. And then your point of contact's name and email address. And then you can use the site and it will actually generate that text file for you that you can then save in the root folder of the location where you're storing your machine readable file. So you can type it up yourself in a text file or you can use this generator, but ultimately you want to make sure you do have that text file with these components and that it is stored alongside your machine readable file in the same root folder. If there's any question about the format of your file name, because again, that has very specific requirements, there's also a file name generator there. You can put in your EIN, your hospital name, and then generate a file name that you can then apply to your either CSV or .json file and make sure that you have a file name that is in the exact format that CMS requires. And then lastly, the newest component that just launched about a week or two ago is the online validator for the machine readable file. So once you have placed your file into either the chosen JSON or CSV format, you can use this tool to run that file through the online validator. You simply upload your file to the page, and then you'll get results letting you know whether or not any errors or warnings were found. So this is the kind of result that you want to see when you run your file through. If any errors or warnings come up, this will be your opportunity to then go ahead, make those corrections, run it through again until you get the all green. So I will turn it over now to my Managing Director, Rick Louie.
I know Rick was having some audio problems and we've got some people working with him, but I'm not sure the problem with his mic has been resolved.
Not a problem, then I'll go ahead and take us through. So turning lemons into lemonade. There's a ton of labor and resource that goes into pulling all of this contract information together in order to fulfill those price transparency requirements. So how can facilities take this opportunity to really see areas that they can identify opportunities to be able to pay for all the resources that are going into creating those machine readable files, shoppable displays, etc. So I'll take you through some of the things that we recommend. Strategic market-based pricing. So one of the things that you can do when you're kind of going through the exercise of price transparency is really to look at an opportunity around a strategic pricing review. You're already going through those efforts of pulling together all of your contract data. So this is a great time to, again, either if you have the resources internally to undertake that endeavor, or if you have a preferred vendor that you like to work with, to bring those folks to the table and look at leveraging this data to see where are there opportunities to potentially adjust your charge master pricing as it relates to your market, and certainly as it relates to your contracts and any opportunities that might be available within your contracts. So this is an example here in this screenshot where this particular client hospital highlighted in yellow is below their market with regards to their pricing for the colonoscopy. So for a service that may still have some sensitivity from a contracting standpoint, this could be an opportunity to increase this price so that it's closer in line to some of these other market facilities, and still also generate some additional net revenue opportunities. So you want to calculate those new prices and the impact on gross charges and net revenues. What you really want to do is, aim for lowering codes where you have opportunity to lower the codes and not impact net revenue, in addition to increasing those prices where you might have some market opportunity to move, and ideally creating a situation where you can actually reduce the prices in your CDM while still netting additional revenue. So again, in this example, we've had a hospital that was 10% higher than market. We got their CDM to a place where it was overall only 6% higher than market, but still able to create an additional $510,000 in net revenue. So again, because you have all these pieces and parts and components sort of coming to the table for that price transparency work, how do you leverage those similar resources and potentially apply them to a strategic pricing initiative that can essentially help pay for the labor that's going into that price transparency work? What about comparing your negotiated rates? So you can certainly ask your price transparency vendor about comparing your rates with competitor machine readable files. Again, one of the goals of price transparency from the perspective of CMS is that this should create some additional competition around pricing. And part of that is making that data available across all providers. So if you're working with a price transparency vendor, this is certainly a time, especially with these changes to the data scheme and things becoming much more standardized, much more easier to process that data, how you may look in comparison to competitor hospitals from a machine readable file to machine readable file perspective. Identifying some of those rate variances by like payers for like services, where there might be some opportunity for negotiation for your particular facility. It also allows you to identify those areas where you might have favorable rates that you really want to aim to preserve. And it allows you to incorporate much more quality data in your arguments when you are opening up contract negotiations, really having that hard and fast data at your fingertips to say, well, I can see for my cardiology service line, this is where I stand in relation to other hospitals in the market for Blue Cross versus Aetna versus Cigna, et cetera. That really allows you to have a much better view of what the market is looking like from a payment standpoint. And it gives you, additional insight and transparency into where you stand in relation to your competitor hospitals. This also allows you to, sort of assess payers as well. Asking your price transparency vendor if they're able to identify those payers that are paying the best rates within your market. So you can see that today for who your payers are, but you don't necessarily know that information for your overall market. So being able to work with a price transparency vendor that's able to give you that additional insight, to be able to use that insight then in your contract negotiations as well is an added benefit of this data being available. Again, not just from the hospital machine readable file standpoint, but also we do have the other arm of pricing transparency, which is the transparency and coverage requirements, which requires payers to publish machine readable files. From day one, their files have had to be in a standard schema. So again, making that data much easier for those of us in the industry who go out and process large files and large volumes of data, being able to process that information and translate it into something usable for providers. That's a really important component of this. And again, as you're going through this work with your vendor, something that you may want to look into of, are you able to give me sort of a payer scorecard of where do the payers rank within my market with regards to their payment rates? Because that is, I think, very important and insightful information. You can also use this to determine rates for new services. So one of the things that you may have been flying blind on previously is I want to bring in a new service and I'm not quite sure what Cigna or Aetna or Blue Cross is going to pay for that. Now with the payer data readily available, you can actually go out there and see for that service what Blue Cross is paying other facilities in your market, other facilities across the country for that particular service before bringing it into your facility. That can also help you understand from your own payer mix standpoint what that might look like from a volumes perspective. It's certainly information that as you're doing these sorts of assessments, you may want to share with your operations and marketing teams to understand sort of the types of payer mix that you want to really help grow for certain service lines, better understanding in your market what the actual payment rates look like for new services as you're bringing them in. Another thing that you certainly would want to do is use this data to audit your payers. So you're now essentially getting a kind of full circle moment here of looking at what your contract says the payer should pay you, what you've actually been paid in your remit data, and then coupling that with the transparency and coverage data, what the payer is saying that they should pay you. And this really allows you that support in going after things like underpayments or things that are just being paid incorrectly, because you now have that data at your fingertips to better support those arguments when you need to go to the table and say to the payer, hey, this is what you've agreed to, but it's not actually what you're doing. This makes the analyzing of payer performance significantly more robust than it's been in previous years, and I think really empowers providers to question payers more on whether or not they're actually abiding by those contract terms that they've spelled out. So this brings us to the conclusion of our presentation. One of the things that we'd like to offer to everyone who's attended this afternoon is a free market pricing report or a free market rates report for Blue Cross Blue Shield. You can choose up to 6 hospitals, and we will send that data over to you so that you can get some insight into where your facility either sits within your market from a pricing standpoint or from a market payment rate standpoint for Blue Cross Blue Shield. With that, I think we'll start the Q&A portion.
Yeah, thank you. Great presentation. And again, I know we're still working with Rick related to his mic. I had some questions submitted to me prior to the webinar, but before we do that, we had a question that came in on the chat, and it said, when you were talking about prices, do these prices include the professional fee component if the physician is an employee of the hospital?
If the physician is an employee of the hospital and the hospital is billing for those services, it would include the physician component. So that would need to be included in your machine readable file.
I know you went over this, but I know it's confusing too. But when you mention market payer rates from machine readable files, how are the payer machine readable files different from hospital machine readable files, and which ones do you use?
So we use both. We go out and we pull the machine readable files that have been posted by hospitals. We also pull the data that's been posted by the payers. So the primary difference is the hospital machine readable files are being generated by the providers based off of the contracts that they have on hand. The payers are generating their payer machine readable files based off of what they're saying is in their system. In a perfect world, we would think that those rates would be the same, but we know as we've gone through the exercise of price transparency on the provider side, we've seen that amendments have come in that didn't get filed in with the primary contract paperwork, or updates or changes have been made that weren't accounted for. And so as we go through the exercise of building out those machine readable files from the provider perspective, those rates that we are pulling from the contract data that's been provided to us may not actually match exactly what it is that the payer is saying in their in their file, in the payer machine readable files. The other primary difference is, as I kind of mentioned earlier, the payers have always had a standard schema for their data. So the way that they had to publish their rates was exactly the same across all payers. Versus from the hospital perspective, as long as you had the required data components, your data could be in any format. And so there was a lot more sort of sorting through and massaging of data that you had to do with the hospital files to really understand what you were looking at in a way that you didn't necessarily have to do with the payer files. It'll definitely allowed for a more accurate assessment of the available rates data because, again, the data that you're intaking is all standardized.
Before we move on, we have a follow-up to the question about the professional fee component, and I'm just going to read it directly out of the chat. If Hospital A with employed physicians includes the professional fee component in the posted charge, and Hospital B has an independent medical staff, how do you compare the prices?
So currently today in machine readable files, that's one of the things that is kind of hard to assess. And we've seen, I think, some information in the media that's been a little bit misleading because they were looking at a machine readable file that maybe had both or had professional component in there, and it made prices for services look a little bit depressed. One of the ways that's being rectified is in the new data schema, there is a billing type now. And so you do indicate whether or not this is a professional or an institutional fee.
So when is that implemented? Is that current or is that to be implemented?
That's to be implemented. So starting July 1st is when that requirement with the designation between the billing types will be required. So presently today, if somebody's using the data schema, that's in there, but there are still files floating around right now that aren't in the new required format. So you may have some of that you've got an intermingling of professional and facility fees, and it's hard to distinguish between the two. Distinguishing between the two will be required going forward, starting on July 1st.
Good. That'll help clarify that. Great question.
Absolutely.
We really appreciate that question. Here's one submitted to me, and I won't name the hospital, but they said we have an outside vendor who's hosting our machine readable file, and separately, we have placed the text file on our hospital website. In your opinion, is this compliant?
So that's not compliant. What you'll want to do is make sure that you work with that vendor that's hosting your file and have them host the text file alongside the machine readable file. It's really critical that those two files are actually being hosted in the same location. I think a lot of people have the misconception that the text file is something that should be like linked out on their site. You don't actually have to have a link to that file on the site. What's most critical is that that file is stored in the same location as your machine readable file, because CMS is going to use that information to use web scrapers and automate locating your machine readable file. So it's critical that they're together.
And I know you touched on this in your presentation, but again, here's a question I received prior to the webinar. How do you determine commercial payer underpayments with just price transparency data?
So when we are looking at commercial payers payment data, what we can do with especially our own clients' data is look at their remits and what we're actually receiving from the payers from an allowable amount standpoint versus what the payer has published as what that expected rate is. That is a really kind of quick way to identify those instances where from the payer's own perspective, because that remit also came from them, where there is a discrepancy in what they're saying they should be paying and what's actually coming across.
This is an unfair question, but I'll ask it anyway.
Go for it.
Have you, not you personally, but you, the company, been successful in helping a hospital who received a corrective action plan from CMS become compliant?
We have, yeah, we're very proud to say we've worked with hospitals who've called us, who've said, hey, we were trying to do this in-house and CMS has sent us a letter. We need help. We've also worked with clients who've worked with other vendors and received letters. We are very proud of our work and being able to get it rectified and actually have it reviewed, have CMS come back with a letter saying, you're all good now, you're in compliance, and you've got it covered. So, we're very proud that we've been able to do that work to help people kind of, get before they reach that CMP, get things corrected and avoid having to be issued a monetary fine.
Not only CMS, but states, as you well know, have become very involved in transparency, readable files, etc. Do you help your clients not only on the federal level, but on the state level? Because each state could have some different legislation.
Absolutely. And we have quite a few clients in Texas. So we know Texas is one of those states that has been very dialed in at the state level. So we've been assisting our clients with, making sure when they complete that attestation and have to send that email to Texas HHSC, we work very closely with them on, here are all your links. These are all the components. This is the information that you need to send over. So we work hand in hand with our clients, both at the federal and the state level.
I've gone through all the questions that people submitted. And by the way, I know Chris Wilson's going to put this out, but he's recording this, and to all the people that are registered, if for any reason you missed, you'll get a recording of this. And I think we've been through the questions that came up in the chat, and I just checked the Q&A. I think we've covered all the questions. So again, my apologies, because I know Rick had some really good advice he wanted to give, and I'm sorry we've had some microphone issues with him. But I'll turn it back over to you for any closing comments as we close out the webinar.
Well, I just want to say thank you again for having us this afternoon. It was a pleasure to get to talk with your group. And I would just reiterate that, this is a great opportunity, particularly if you're working with a vendor on price transparency, to look at those ways that you can leverage a lot of this additional data out here that's going to be available to you to really support other initiatives and endeavors that you're going through at your facility from a pricing standpoint. Seeing this as, an opportunity rather than a burden is definitely the approach that we need to take, because, the train has left the station. It's not going to turn back on the price transparency. So how are we really, from a provider perspective, utilizing the data that's being put out there to make life as much easier for you guys as you possibly can, because we know you got a lot coming at you, and it's, ever changing every day for hospitals. How are you, making sure that you're leveraging those opportunities?
Well said. And I think you really summed it up. The train truly has left the station, and we want to be compliant, and we want to make sure we meet all federal and state guidelines. I just want to thank hospital pricing specialists. This has been an excellent presentation. We really appreciate it. We appreciate all the people that joined the webinar. We've got quite a few people on, and I know we've got people registered that are looking forward to getting the recording. So at this time, we'll bring this webinar to a conclusion, but thanks to everyone for your attention to this very important topic, and we wish everyone a very safe rest of the day. Thank you for being with us.
Thank you.